I've been working with a parent with sleep training. There's several different things that we're doing. Sleep training, getting from the boob to the bottle. And the funny thing is, he didn't take the bottle. He took the sippy cup.
Oh, you
He
were
went
telling me about that.
straight. Yes, he went straight to the sippy cup. So, and it's hard. And I was just doing a reel about sleep training. Um, because sleep training is more than just about the child. Sleep training is about the parent. It's about everybody being on the same page. It's about building confidence in the parents. It's about getting enough nutritious foods, whether they're on the bottle only or if they're on the bottle and food. We still have to have enough food to sustain him overnight.
Mm-hmm.
And in order to sustain a child overnight, they have to have 2.5 ounces times their weight. That's in the beginning. Now, as they get older, their doctor will probably cut them off. And say, she's drinking too much milk. He doesn't need 32 ounces of milk in a day. But they're first starting out, or if they're smaller than they're not on the chart, then they're going to need some nutrition. So sleep training is about nutrition. It is about having confidence in your child. It's about self-soothing. It's about being patient. It's about being able to hear your child cry, because it's not, I try to use the gentle sleep and not the cry it out. But even in the gentle sleep, you have to let a child work through it. You can't just go run and jump. Oh, let me go get him. He's crying. No, give him a minute. Give them some time to figure it out, because if they have a pacifier, they'll stick it in their mouth. If they have a thumb, they'll stick it in their mouth. Whatever method it is that they use to self-soothe, you need to give them time to go into self-soothe mode. Now, if they wake up screaming bloody murder, yeah, there's something wrong. They're probably in pain. But if they just wake up and go, that's not crying. So we have to learn the difference between a whine and a cry, and we have to learn patience, and we have to learn, it's just so many things that we have to teach parents, and being consistent. The number one thing is being consistent. And it's hard for us to be consistent. Mm-hmm. They have to trust us, because every time the child whimpers, you come running, busting through the door, and they see you, of course, they're going to want you. It makes our job harder. We have to stay there longer. Or if we have a contract beyond that contract, I can do this in 2 weeks if you trust me. I can do this in 2 weeks if you let me do my job. That's why you hired me. I am the professional sleep trainer. Trust me, I got this. Mm-hmm. But if you don't trust me and you keep running in and you keep interfering and we're not on the same page, then I may have to leave you high and dry, because we have, as NCSs, we have jobs lined up months in advance. A lot of women, when they get to that second trimester and say, okay, this is going to work, let me find me some nighttime help. So I've had jobs booked 6 months in advance. It's not about your convenience. It's about what you need to do for your child.
What kind of training did you have to become an NCS?
I went through Newborn Care Solutions, and actually the experience that I had before I went through Newborn Care Solutions and became a NCS, I was doing NCS work before I became an NCS. Most of the families that I've had, when I became a nanny, I had like 10 babies in a row. And so it was like, well, can you sleep train them? Yes, I can sleep train them. I got them on the schedule. I did, all the things that we learned in the NCS class, I was already doing. The most I got out of that class was a confidence builder because it made me feel good that I didn't go to school for this, but I'm doing exactly what the books say. And I know that each child is different and I adapt to each child, but I learned the terminology because everybody loves Dr. Google, and you have to give them something to look up because they're going to doubt you. They're going to say, well, what is this? And you can tell them, explain to them what it is in layman's terms, but what is it called? So I learned a lot of terminology so I can pass it on to the parents so they can go, let me see, what is that? Oh, she was right. Okay. That's what I learned.
So then, do you think that nannies have to go to school then for it, or can they just keep doing it? Like, what's the benefit of going to school?
People like to see diplomas and certifications. And how do I know that you really did this? They need references. They need, okay, so let me see, what school did you go to? Is it reputable? Is it this? They will check you out. They will stalk you on Facebook, but want to know what you're doing, who you're working with, what age group they were in. So going to school proves to them, yes, I'm certified. Oh, well, then I guess you know what you're doing. They're still going to look up everything you say. They're still going to question everything you do. But for me, being certified is a confidence, knowing that I learned from the best. Now, there are a lot of people out there. There are a lot of companies, NCS companies out there that teach, but I just think that the class that I took was the best for me. And I suggest everyone takes the best class for them. Some parents, when they just continue to just, it feels like they're like on you and it's like crawling and you like, stop already. And you want to ask them, okay, so what piece of paper did you say that says you're a mama? You know, but it can be difficult without that piece of paper because the competition is so broad out there. I mean, everybody's doing it. Oh, I want to be an NCS. I want to be a night nanny. But I can say you get what you pay for. And sometimes you get a whole lot less than what you think you're paying for. So that certificate says, this is what I am qualified for. My experience says, okay, so she has qualified herself through experience, and now she has a certificate to back up the experience. And there's a few other tricks up my sleeves that nobody knows about, because if that baby is doing a certain thing, I remember that with somebody else. Let me try this. And I'll tell mom and dad, one child just trust me. And baby responds to it, and they're like, how did you know that would work? Let's just say 41 years in the business. It does pay off. So yeah, that certificate matters.
That's so cool. Yeah, I didn't even really know about like what an NCS was before. So thanks.
You're welcome.